Hi, my name is Arjun Gupta, and I'm a medical oncology fellow at the Sidney Kimmel Comprehensive Cancer Center here at Johns Hopkins. In an essay being published in JAMA Oncology, I describe my journey and evolution through the first year of clinical oncology fellowship and the quite special relationship I shared with a patient who was diagnosed with colon cancer and his wife. He was the first patient I cared for as an oncologist, and the first patient is always special. The essay is titled "Not on My Watch," an indicator of the responsibility and ownership I felt for him. Ultimately, he ended up dying within 1 year of being diagnosed with colon cancer. I later realized that he was not the one under my watch, I was the one under his. I learned many things from him and his wife. They made me realize the importance of family, and I got much better at FaceTiming mom back home in New Delhi, India. My biggest passion outside of medicine is cricket, and they cajoled me into going to attend the Cricket World Cup going on right now in the United Kingdom. I got to watch perhaps the biggest game that exists in cricket, the India-Pakistan cricket game. Professionally, motivated by this experience, I have decided to join the GI or Gastrointestinal Oncology clinical group here at Hopkins. Our time and experience together is a valuable reminder to me as I start to develop and evaluate quality metrics in cancer care. We actually did quite horribly on several quality metrics. We were hospitalized in the last month of life. We had emergency department and urgent care visits in the last few weeks of life. Our hospice length of stay was less than a week. But none of these numbers can perhaps cover the entire patient or physician experience, which was unavoidable, painful, and occasionally quite beautiful. As I enter dedicated research time, and I'm applying for grants, writing clinical trial protocols, and attending conferences, it reminds me that I could not survive without direct patient care, and that everything we do, whether that be basic science, outcomes work, or clinical trials, is ultimately aimed at improving the lives of our patients. I would like to thank my mentors and my co-fellows who have helped me tremendously along this journey. I'd also like to tell you about some lines that a mentor wrote to me when this patient started doing poorly. I wrote to this mentor letting him know that I was very disappointed and upset that this patient was going to die soon. He wrote to me, "Arjun, in oncology, sometimes the best jobs you do in taking care of patients don't result in a good outcome. You should feel confident that you gave him all that you could give. You have been more than his doctor, and that is rare." A massive thank you to the patient and his family for giving me their trust and allowing me to share this story, especially the patient's wife. I will carry this experience for the rest of my life. I hope you enjoy reading it. Thank you.